Question number 5. A 12-year-old boy admitted to the intensive care unit one day ago for severe pneumonia suddenly developed hypotension. He was started on empiric antibiotics and his blood culture reports are pending. According to the nurse, the patient was doing fine until his blood pressure suddenly dropped. Vital signs include blood pressure of 88 by 58, temperature of 39.4, 103 degree Fahrenheit. Fahrenheit usually tells you the fever, so always go for Fahrenheit. Pulse is 120 per minute. Respiratory rate is 24. His limbs feel warm. The resident physician decides to start him on intravenous vasopressors as the blood pressure is not responding to intravenous fluids. The on-call intensivist suspects shock due to a bacterial toxin. What is the mechanism of the action of the toxin most likely involved in the pathogenesis of the patient's condition? So they are asking that what toxin, what is causing the shock? Okay, what mediator? So option A is degradation of lecithin in the cell membranes. Option B, inhibition of acetylcholine esterase release, acetylcholine release. Option C, inactivation of elongation factor 2. Option D, inhibition of GABA and glycine. Option E, release of tumor necrosis factor, TNF. Okay, so now a patient who is in shock, what will they have? They will have, of course, infectious disease is present, septic shock. So an infectious disease presents with severe pneumonia. So infectious disease is present, suddenly develops hypotension. Hypotension is present. He was started on empiric antibiotics and his blood culture reports are pending. According to the nurse, the patient was doing fine until his blood pressure suddenly dropped. Vitals were blood pressure has dropped. So blood pressure drop is very characteristic of a shock. Okay. Respiratory rate is 24. Limbs are warm. Limbs being warm is a sign of septic shock. The resident physician starts him on intravenous vasopressors as blood pressure is not responding to IV fluids. This is also specific of shock. Now we want to know that what is causing the shock. Now a septic shock is caused by release of tumor necrosis factor. This you need to remember. This is a factual data you need to know. So here they have shown how macrophage activation will occur and what will be released and how it will cause fever, hypotension. TNF alpha is released. So TNF alpha is the reason why we get shock. You can also remember IL-1, IL-6 and TNF alpha. These three are the most important. Nitric oxide is also responsible, but to a lesser extent. IL-1, IL-6 and TNF alpha are the major contributors over here for shock. Alright. Something else, okay, let's see other options. Degradation of lecithin in cell membranes. This is not important, okay. The degradation of lecithin won't cause anything. Inhibition of acetylcholine release. This will also not cause anything. Inactivation of elongation factor 2. This is a toxin mechanism of a different toxin. And diphtherial toxin actually causes inactivation of elongation factor 2. I think pertussis toxin also is involved like this. Inhibition of GABA and glycine. This is for Clostridium. Okay. Clostridium tetani causes this. And release of tumor necrosis, as we have already discussed.
Thanks for watching. Please give a thumbs up and subscribe for more.